MS and venous obstruction.
Thank you everybody for coming. Thank you both for inviting me to deliver this lecture. This guy is a friend of mine, Dr. Simka. He was assisted me to preparing this lecture. Any part of the body is important, but I think head and brain are most important. So, ladies and gentlemen, now time for the brain. What is the multiple sclerosis? It is not fully defined disease. However, neurologists think that is autoimmune disorder. The discovery of occlusion, something wrong. I need to go back. So CCSVI, it is the entity discovered lastly by Paolo Zamboni from Italy. He refreshing possible relationships between MS and CCSVI. He discovered in these patients occlusions in the vein system or significant stenosis, and also discovered iron plaques in the brain. Here you see progressed atrophy of small intracerebral veins in MS patients. From left to the right, you clearly see that in advanced stage of MS, nearly not seen venous network. If somebody discovers such occlusions or stenosis, seems to be reasonable to unblock such an obstruction. Others, of course, says don't touch these patients until an impact of venous insufficiency on MS was demonstrated. Procedure to alleviate these vascular pathologies were proven technically feasible and safe, and the treatments were proven to result in clinical benefit. So, what is the rationale for the treatment for CCSVI? As far as we know, no pharmacological treatment is effective in the long run. And when even in only subgroup of MS patients you are going to achieve benefit, so this procedure seems to be reasonable to do it. Here you have possible relationships between MS and CCSVI. Maybe it is the same entity. Maybe MS is the cause of CCSVI, or CCSVI is a cause of MS, or they influence each other. There are many questions to be answered. Does chronic cerebrospinal venous insufficiency exist? If it does, is it exclusively associated with multiple sclerosis? If associated, does such a connection have an impact on neurological pathology? the problems with definition, because our tools are not very good. So there are some differences between different methods of diagnosis. So small but relevant differences between protocols and interpretations of the findings. When we examine more and more patients with MS, we discover much more prevalence of CCSVI to the MS patient. We think that this pathology firstly should be diagnosed using catheter venography. Of course, definition of CCSVI should not include clinical diagnosis of multiple sclerosis. It seems to be independent pathology, even if CCSVI could primarily be found in MS patients. Does chronic CCSVI exist? Yes, at least in terms of angiographic findings in MS patients. Here you see 13 different studies that have shown 85 up to 100% of prevalence of venous lesions in MS patients. CCSVI seems to be a clinical entity distinct from multiple sclerosis. The majority of, but not all, MS patients can demonstrate venous lesions. Such vascular abnormalities can also be found in non-multiple sclerosis individuals and also in healthy controls. So we need studies to confirm these relationships. As you see, also such discovery was in the patient with Parkinson's disease. Sonographic signs of CCSVI commonly found in the patient suffering from other neurodegenerative pathologies, Parkinson's disease, migraine, non-neurological autoimmune disorders. CCSVI lesions are preferentially found in the left internal jugular vein, which is congenital defect. It is unlikely that CCSVI is secondary to pathological process of nervous tissue. Such lesions are free from inflammation in histological exam. Pro-inflammatory and toxic role for iron, chronic brain hypoxia resulting from blockage of venous outflow, disintegration of the blood-brain barrier caused by stagnant and refluxing flow pattern in cerebral venules. It has recently been suggested that this entity may change benign infection, latent infection, caused by hypothetical infection of MS into clinically overt neurological disease. It is a very interesting hypothesis to be discovered. Here you have papers on safety of endovascular procedures for CCSVI, 10 articles. No mortality, very low incidence of major complications, only 1–2%. Another example of compression syndrome. at the neck region. Already published research, over 1,000 patients, 8 open label trials. Here you have MRI, efficacy of endovascular treatment for CCSVI. Here you have example of normalization of MRI bolt after angioplasty in CCSVI patients. From left to side, from left to right, you clearly see just restoration of venous circulation in such patients. Clinical efficacy of endovascular treatment, also randomized control trials with sham surgery are ongoing. That's all what I would like to say.